Hello and welcome to Caregivers First, a show brought to you by SCAN, the Social Community Activities Network. SCAN is a nonprofit agency dedicated to helping active adults stay informed, empowered, and inspired. I am your host, Lynette Whiteman, and I am the Executive Director of Caregiver Volunteers of Central Jersey. Caregivers First was developed to give you knowledge and help you navigate this time in your life. Our guests are experts who provide the latest information and tips to make your life easier. I'd like to welcome my guest today, Tracey Wolfman, who is the CEO of We Care Adult Care. Welcome, Tracey. Thank you for being here.
Lynette, thank you so much for having me on the show today.
It's great to see you.
Thank you.
So tell me, you began We Care Adult Care. This is your baby.
Yes, it is. Indeed, it is.
And you opened it in 2000,
Yes.
Is that correct? So tell me, what was your journey? What brought you to do this?
Okay, so when I was in my early 20s, I went to Florida as a traveling nurse for a year. And I worked on a very large geriatric campus that had independent, assisted, and adult daycare, which New Jersey at the time had no assisted living yet. So it was a whole new concept to me. So my contract was up, I'm back home, go to work in the hospital. Spent 17 years working in the hospital and always saw that poor senior, you know, come into the hospital for a few days stay, get confused, and the facility doctors, whoever, would tell them that they were unsafe to go home. So they would ultimately be placed in long-term care. And so many times I just thought it was unnecessary and too premature. So in the back of my head, I always had that adult daycare center.
Wow.
So over the years prior to that, I would go and look at them. Anytime I went on vacation in another state, I would look at the adult daycare centers.
What a fun traveling partner.
Yes. Well, you know, it only took a short time, but I would go to, because that's when we used phone books. I hate to say that.
Wow.
I mean, we weren't using Google and looking them up. And they all had a great component, but I never found one that had all the components in one location. So ultimately, you know, then I wrote my business plan and went about trying to get funding to do that.
Wow.
And I had to convince a banker to give me a loan for really an unknown entity at the time, because, you know, it was like in the late 80s.
Wow. So you were quite brave doing this. This was really a leap of faith for you.
I think I was young and dumb, really, because I didn't really realize, you know, that I was trying to accomplish something that really was kind of a big mountain to climb.
Yeah. So what is your vision? Like, what was your vision for your adult daycare center? What did you want for that?
My vision for that was to have everything that the senior or the caregiver would need in one location in a non-institute home-like setting, and to give them the ability to prosper, you know, regain some of their self-esteem and self-worth, and have a really great day and a safe environment, but add that medical component to it. So
yeah, that's what I want to talk about. I think for people, they don't really know what adult daycare is. They daycare, you think of kids. Adult daycare, you're like, what? And then what's the difference between social and medical daycares?
So when I talk about adult daycare, because as you know, I'm very passionate about it, but when we talk about caring for somebody with needs, we have to include the entire spectrum. So seniors, typically, I will go out and speak with them. We have senior centers, we have home care, we have adult daycare, we have assisted livings, and we have long-term care. So you really need to give people an overview of what all those options are, and the benefits of each of them, where they fit in, because at some time you might journey through all of those places. And also the most important thing is the cost factor. So when I talk about adult daycare, it's a comprehensive day. Most centers are all-inclusive. So you're going to have transportation, you're going to have meals, you're going to have nursing care, you're going to have a structured activities program. We have a registered nurse on staff. We have a beauty and barber shop. We provide them with showers if a daughter may be taking care of her dad or a son taking care of mom. So all of those services under one roof give them the opportunity to be who they want to be, and be safe.
And so you're in a medical daycare center.
We are a medical adult daycare center,
right.
licensed by the New Jersey Department of Health and Senior Services.
Okay.
We do have also a license for social daycare. So if somebody doesn't meet the medical requirement, because they do have to have a medical need to be able to be approved under the medical component of it.
Okay.
So if they don't have that medical need, they can still come and participate in our social program.
Okay. And do you specialize in Alzheimer's disease patients, or do you have a mix of people that come?
We do have a mix of people that come, but I am very passionate about Alzheimer's disease. I'm an advocate for them.
Right.
Our staff has been trained for caring for Alzheimer's patients, so yes, we do have a component specializing in Alzheimer's disease for people that have it or early dementia.
Okay. So when somebody's thinking about placing their loved one in an adult daycare, or they feel like it's time to do that, what do you recommend that they do? Because we help a lot of caregivers, and we always recommend it.
Right.
And they always say, oh, mom will never go to that. Dad, he or she will never go. Do you recommend that they go look around and not take the person that they want to play?
To the center.
What's the process?
So it can go either way. For families that know nothing about adult daycare, it's probably best for them to come and have a walkthrough.
Without the person?
Without the person.
Okay.
Because a lot of times when people come into our facility, we have to try and talk to them because we don't want to offend the person. We don't know
Right.
really what their cognitive ability is. Do they know why they're here? You know, a lot of them just walk in, which we have an open door policy, and we say you can come anytime, you don't need an appointment. But a lot of times people will walk in with their mom, dad, husband, wife, and you know, we like to kind of talk to them on the side. And if that's the case, one of my staff will usually intercede and try and get some information on the side, so we separate them a little bit. But it's good to do the initial walkthrough, get the information, because you need to get a feel for a place. And one walkthrough really doesn't do that. You know, so it goes either way.
And what should they say to their loved one? Like, where are you going? Like, how do you explain
Right.
it?
So there's a misconception about adult daycare because they think, oh, the person sometimes thinks you're trying to get rid of me and you're going to drop me off and you're never coming back.
Right.
So we really like to take a very low-key approach, something like a senior center, a club.
Okay.
We invite them for lunch for the day, and when they walk in, we tell them you're invited to come here for lunch. It's totally a fun place to be. You're not going to stay here, you know, because they have to ease into it. The concept for most people of that age group is very hard for them to take because, you know, these were people that were working out in the community. They're somebody who did something. And a lot of times we forget about that. We like to empower them and get them to be the best that they can be during the day.
Yeah. And I imagine it's hard even, I mean, I'm just thinking about high school. When you're walking into a new cafeteria or something
absolutely,
like
absolutely.
I would hate that.
So what we like to do is when somebody new comes in, we do a big introduction for them, and we also buddy them up with somebody for the day.
Yeah.
So that other member who's attending our center is their buddy for the day, and the staff is really all over the person because it's intimidating.
Yeah.
You know, like any
yeah.
one of us walking
Right.
into a group by ourselves
Right.
and having to, you know, stare around at everyone and say,
Yeah,
what
and
am
they
I
know
doing
it,
here?
right, especially if you have cognitive difficulties, put that. Do you recommend that people go with their loved one, in like drive them there if they can, or go for the first couple days and stay with them, or put them on the bus the first day?
Right. So typically we invite people for a complimentary day.
Okay.
And on that day, we encourage the families to drive them there.
Okay.
And we have a shortened day because coming for a full day on the first go is long, it's
Right.
overwhelming.
Right.
So the family member might bring them for lunch, so they'll come a little later in the morning, you know, just have a little time in our activities department going for lunch, and then we have them picked up before the afternoon buses start going home.
Okay. Okay.
And the family, we always tell them they're welcome if they feel better staying with the person, yes, they are allowed, but the person's not going to acclimate as well if you're standing next to them the whole time. So, but whatever works, we're happy to accommodate.
What is the period of time? I'm not thinking of the word. The acclimation period. Like, when do usually people feel comfortable? What is the adjustment period?
Right. So it usually can take from 1 to 3 weeks.
Okay.
I mean, I'm saying on average.
Right.
You know, you have people, they're hesitant to come, they don't want to come. And then you have those that walk right in and they're so happy to be out of their four walls and they were sitting home doing nothing. So, you know, it depends on the person
Right.
and how they're going to adjust, and also what their disability may be or may not be.
Yeah.
You know, if they have a medical component, it's very easy because coming to us is better than going into a long-term care facility. So the nurse is on staff and she can take care of their needs.
Right. I wonder if is there a correlation, like if you were an introverted person or extroverted? Like if you were the life of the party when you were younger, it's probably easier for you, I'm imagining, right?
It is,
like,
but the
hey.
interesting thing is I will have family after family after family come in and say to me, my mother, my father was not a joiner, they were
Yeah.
not social, and they do nothing. And something happens inside of our walls, and they become a completely different person.
That's nice.
Because I think there comes a point where when you're the parents and you may be living with the child, and you're trying to still be the parent as much as you're struggling with that. But inside those walls, these people become who they want to be.
Aw.
They're free, and they are so different. We have families come, I tell them, like, come and watch.
Yeah, yeah, yeah.
You know, because they can't even believe. One lady was up on the microphone singing, and her daughter said, there's no way possible. I said, you come, I will make sure they have a sing-along that day.
Yeah, yeah,
And
yeah.
she was just with the biggest smile on her face.
Wow.
Because her mother had the microphone and was singing her heart out.
That's sweet.
Yeah.
Yeah.
So, I mean, there's
Yeah.
so many stories. You never know which way it's going to be.
It's going to go. And then I imagine they make like good friends. If they like, people generally come like a Monday, Wednesday, Friday, or a Tuesday, Thursday with the
Yes.
same group, so they know.
Definitely, they
that-
get their
yeah.
friends, they get their cliques.
Yep, yep, yep.
You know,
Yeah.
sometimes we have to change it up a little bit.
Yeah.
Because they do get very attached, and then somebody will not be there anymore.
Yeah.
Whether they move on to a long-term
Right.
care facility or they just can't come anymore.
Right.
So as much as we love them to make their friends, we try and make it more than just one friend.
Yeah, yeah, I could see that. Any romances? Have you had romances?
We have had, yes, we've had romances. Actually, one daughter had to change her father's phone because she got a bill for hundreds of dollars. He had just a few local calls available on his service. And she wanted to encourage him to have this relationship, but they would talk on the phone every night, all night, after they left the center. And we even had a 50-year wedding renewal, and we held the wedding. The mayor came.
sweet.
We transformed the entire activities area into a chapel.
Nice.
So yeah, so we've done those things.
So this must be so rewarding for you, like to have this vision, to take this leap of faith, and then to see it 18 years later. Wow, that must be like...
You know what? Every day you walk in and it's a different feeling. It's
Yeah.
a different person whose life you're hoping to change
Yeah.
and create an environment for them to grow and just not be so isolated and not have a life.
Yep. All right, we're going to take a short break.
Okay.
We're going to take a little break, and then when we come back with Tracey, we're going to talk more about the world of adult daycare. So stay tuned.
You probably already know that rehabilitation is a must for successful recovery from surgery, injury, or serious illness. What you may not know is that you're free to choose where you go for rehab. In Monmouth and Ocean County, the compelling choice is Care One. Where you choose to go for rehab matters, and with Care One, you have 4 convenient locations to choose from in Monmouth and Ocean counties. Care One at Jackson, Care One at Wall, Care One at Homedale, and Care One at King James in the Atlantic Highlands. At Care One, You'll work with a team of experts to develop a plan based on your needs and goals. You'll have the full support of caring, compassionate physicians, RNs, licensed therapists, and nutritionists dedicated to helping you recover successfully without setbacks at a pace that makes you comfortable and successful in meeting your rehabilitation goals. Once you take the first step with us, you'll never look back. Call 877-99-CARE-1 today and come for a tour.
Welcome back to SCAN and Caregivers First. I am your host, Lynette Whiteman, Executive Director of Caregiver Volunteers of Central Jersey, and I'm having a great conversation with Tracey Wolfman, who is the CEO of We Care Adult Care. So welcome back, Tracey.
Thank you, Lynette.
So talk to us a little bit about if a caregiver is interested in exploring this world, they feel like it's time maybe to look into adult daycare for their loved one. When they go and visit a place, what questions should they be asking? How can they be informed about this world?
Excuse me. Well, first of all, they need someplace that's going to meet the needs of when they need to be attending a center. So, I mean, I would ask about hours of operation, what kind of staff they have on board, how many people, staff members per resident or member, we call them members at our center,
okay,
that they would have. If they're able to meet the medical needs of the person that's attending, what kind of meals will be served, is transportation provided?
Okay.
And really, I would also talk to people that are attending, and I would also, if there's any family members, you speak to them. It's always good to get somebody else's point of view.
Mm-hmm.
You know, any time in a day, you know, we all think we're doing okay job, but it's always great to get other people's feedback.
So going back to the questions, the staffing, what is a good ratio? What is something that would be, oh, that's good?
Right. So if you are licensed, and most adult daycares should be licensed by the Department of Health and Senior Services, wherever they may be.
Okay.
And their regulations are 1 staff member for every 9 people that attend.
Okay.
Our center happens to have the New Jersey Department of Health Alzheimer's grant. So when you have that population, the regulations, you must have 1 staff member for every 5 people.
Okay.
So you want to make sure, but in that component, you know, you're going to have other staff such as social worker, nurses, the program assistants, activities.
Mm-hmm. So you want to ask how many staff members per member in the room, not auxiliary, not like social worker.
Correct.
In
Correct.
the room with the person.
Right.
That, okay.
And you just want to, I mean, if you walk into a program, you're going to be able to visually see, you know, if it's being run and monitored properly,
Mm-hmm.
you know, unless
Right.
you have a scheduled tour and they set everything.
Right.
So
Okay. So funding.
funding, always the big question.
Always the big question.
So funding for adult daycare centers. So when we talk about the continuum of care, as we have, you know, the aspects of it,
Right.
we have like 9 different grants that
Okay.
will subsidize people to attend adult daycare.
Okay.
So, excuse me for 1 minute.
It's okay. So the funding, when you welcome somebody or go to do a home visit,
Correct.
you figure out, okay, you might qualify for these. These are all finance-based, like based on the person's
Right.
finances?
So there's not many grants out there for home care, and we
Right.
know that Medicare does not pay for adult daycare. Medicaid will cover adult daycare, but there's other grants. The JAC program, which is a subsidized Medicare waiver program. Statewide Respite has a program that will give people some days to attend if they meet the financial requirements.
Okay.
The Department of Health has the Alzheimer's grant. If they have a diagnosis of Alzheimer's disease, they can attend under that
Okay.
with a copay from $0 to $60.
Okay.
Alzheimer's New Jersey gives a $1,000 respite grant, non-financial based.
Okay.
So if somebody wanted to access that to do a trial for 10 days, they could do that.
Right. So do most daycare centers, you have 9 grants that.
Correct.
All right. Is that unique or do a lot of them have?
I think some of them have other funding sources.
Okay.
For Monmouth County, I think we're the only ones that have the New Jersey Department of Health and Senior Services Alzheimer's grant.
So that's definitely a question to ask.
It is. Well, you want to know how you're going to pay for it.
Right, right. And what
I mean,
yeah.
most people are private paying, and especially if you have home health care at home now, you know, there's no funding really
Right.
for that. So when you talk about the continuum of care, adult daycare, about $12 an hour, which we don't do hourly though.
Right.
Because our regulations are that they must be in our building for 5 hours. But home care is about $21 to $25 an hour.
Right.
So statistically speaking, people will attend daycare 3 to 5 years.
Okay.
If they stay the 5 years, you're saving about $500,000.
Wow.
Because we know long-term care assisted livings are about $8,000 to $10,000 a month.
Right, right,
So
Right.
it's a far cheaper
right.
option of care, and it will hold off for a little while.
But that's a lot of money. to
It's
save.
a ton of money.
Yeah, and I think it's pure time for the caregiver. It's almost like when your kid goes to daycare when they're 3 years old
Right.
or something like that. You go home and you're running around the rooms so happy that you have this time, especially for a caregiver whose loved one might be up all night. And
most of them
right.
do have those
so
issues.
at least they could go home and take a nap or read the paper, and they know that they have that time.
Or run their own errands.
Right, 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 right.
So for the caregiver, it's the biggest relief. And I think
Yes.
most caregivers, once they become a caregiver, they don't realize that they need that option.
Right.
And you really can't be a good caregiver unless you're caring for yourself.
Right.
And caregivers don't care for themselves.
So do you recommend that people look into daycare, let's say that their loved one has a diagnosis of Alzheimer's disease, do you recommend that they start their person before it gets into more the moderate to severe, or what's your
So a trend
advice?
over the last few years ago, people started, mom or dad or husband and wife, to come for a social component, to get out of the house and have something to do.
Right.
Now a lot of times people are coming in because they're completely burnt out from being a caregiver and they just can't take it anymore. Earlier on, a day or two a week, get them in the routine, and as their illness or disease progresses, they're getting care, they're getting monitoring by a nurse,
Right.
and then you don't have these hospitalizations because, you know, once they go into the hospital, it just escalates everything.
Right.
So it's much better to start earlier at a few days a week.
And they're used to it. They're used to getting on a bus. It becomes part of
It's
their
routine, it's structure,
Right.
it's good for them. They
Right.
get up, they get out.
Yeah, yeah. So, yeah, that's good advice for people to know.
Oh,
to,
definitely.
To not wait. So, we care adult care. Your area is in what towns do you cover in
So
Monmouth?
we cover most of Monmouth County with the exception of the far western part of Monmouth County
Okay.
because we do have guidelines and regulations that we have to meet, and people cannot be on the bus. You know, there's certain limitations.
Okay.
So to drive a distance and come back, you know, it's an hour each way.
And you're located in Wall, your facility?
No, we're in Middletown.
Middletown.
So we're located on in Union Square Mall on Highway 35 in Middletown.
And so is it, like, if people are thinking about it, an hour away? Like, do you have an hour circumference?
So it's
or
about 12 miles out.
12 miles from Middletown.
Correct.
Okay. And I know, because I see you, I follow your posts and things like that.
Oh, thank
it
you.
seems like you have great meals at your day. Like, that was something that was
Okay.
important to you. Because I want to come for lunch, because
Oh.
it seems like you have great meals.
Well, thank you, Lynette. So we are very fortunate that there's a restaurant right in our shopping center, and we have a dietitian who makes our menus, and they follow the menus, but it does come from a restaurant.
Nice.
And it's Talercio's Gourmet Deli and Restaurant in Middletown, and they've been serving our food since the day we opened.
Wow.
So, you know, so many people complain about food all the time.
Uh-huh.
We send out yearly surveys. I don't think we've ever got a complaint about the food because half the people there, their families, and my staff also use them to cater at parties they have.
Nice.
So the food is good, and it's no different you know, he doesn't give us different food than what he serves to the customers that walk in.
Nice.
So yes, it is. The food is good.
Yeah, and you have physical therapists that come in to We Care Adult
So
Care?
right above us, we have a complete rehab center.
Okay.
And people can get physical therapy and occupational therapy. Also, we have a podiatrist that comes in
Nice.
on a monthly basis or bi-monthly basis. Our local dentist, visiting dentist, Dr. Stu Rubin, comes in. We provide lab work on site that can be done, showers, the beauty parlor. So anything that a caregiver typically has to take their family member to, we try to provide on site. Because, sometimes it's the obstacles of getting them in and out of the vehicle. Other times it's time constraints because, everyone is working today.
Yep.
And other times they're just too busy. So we try and get all those things done. And I think people really benefit from the physical and occupational therapy because they're getting when you're at home getting it, you're limited on the ability to do certain exercises and things like that.
Yeah, I think what you said before, as far as just breaking out of social isolation, is so important because generally, I know I live with my mother, and she's just in her room all day, and she talks to me and my husband,
Right,
and our dog, but just being with other people and eating a meal with somebody else and gossiping, or who's that person, or what's that person doing at my table. It's just so important.
It is important, and it's important for them to socialize amongst their peers.
Yeah.
No matter who they are, they're able to have a conversation with you, but it's different than having a conversation with a friend.
Yes.
And though they say they're fine all the time, they're really not.
Right.
I mean, we had this one woman, I'll just give you an example. She came with her daughter to bring her husband. And I remember when she walked through, she was very flat and, looking at us all, and she didn't have much to say. The daughter happened to be a nurse, and she signed the father up, and the father came for probably 2 or 3 years, and then he was hospitalized and had to go to long-term care. So now we're fast forward 3 years later, the daughter comes and she brings her mom back. And mom is the same way, but now she has a diagnosis of memory impairment. So she walks in, and I was like, oh, this is going to be tough. And she came willingly, but was very quiet, didn't say much. Then you see her another week later, and now she's got a little makeup on. Then the next week she's got lipstick on. And then the daughter calls me. She says, Tracey, my mother wants me to go to the vault and get her jewelry.
Aww.
And I said to her, go to the dollar store and buy her jewelry, and because we don't want her wearing that. By the time she left our facility, because the daughter had to relocate, bracelets up both arms, her lipstick on. And it's just because she was like free. She was no longer a caregiver, and maybe that's why she was that way, but we don't know.
Right.
So
it's wonderful.
It's just to see those kind of stories and how they interact, and they feel important.
Yep. Well, thank you, Tracey. I mean, I think it's got to be so rewarding for you, and congratulations on getting your vision and having that happen. That's wonderful.
You know what? It's been a great run for 18 years.
Yeah.
We hope to have another 18 years or so and just grow and take care of more seniors.
Great. Well, thank you for joining us today. We're going to have Tracey's information up on our screen. Just real quick, say your telephone number, Tracey, so people can contact you.
Oh, the telephone number is 732-741-7363.
Wonderful. So if you're interested in daycare or want to learn more about it, I'm sure Tracey would be happy to talk to you on the phone. And I thank you for joining us today, and we hope that we see you again next time.